by law, cover every single service that Medicare Part A and Part B covers. And they're also allowed to cover additional services not offered by original Medicare, such as vision, dental, and hearing. And some of them expand way beyond that. And there are two types of plans in the Medicare Advantage plan. One's an HMO and one's a PPO. So, and it's called an MA plan for Medicare Advantage. And if you hear the words MAPD, this means that it's a Medicare Advantage prescription drug plan, and it already has prescription coverage built into the plan. The thing you want to be aware of if you've never done this before is Medicare Advantage plans have provider and pharmacy networks. Some have premiums, some do not, and there are other costs involved that vary by plan. Okay. Now, in order to be eligible for the Medicare Advantage plan, you have 4 things that you need to do. Actually, 3 now that we're going into 2021. The first is you must be enrolled in Medicare Part A and Part B. You must reside in the plan's service area, and you must be a U.S. citizen or lawfully present in the United States. You're going to have to be that anyway to get Medicare Part A and B. So, you pretty much got that covered if you're in Part A and Part B. If you're enrolling still in a 2020 plan, you're new to Medicare, say November 1st or December 1st, you cannot enroll in a Medicare Advantage plan if you have end-stage renal disease. But for 2021, if you have end-stage renal disease, then you may enroll in a Medicare Advantage plan. So if you have ESRD, end-stage renal disease, and you're looking at open enrollment, you've been on Medicare for a while, and you're like, I would really like an Advantage plan during this open enrollment period, you are eligible now to enroll in one. Those plans begin on January 1st of 2021. The coverage begins. You have to enroll now, but the coverage begins. Okay. Now, Medicare Advantage networks are set up by the plan carrier. In order to cover the maximum amount of benefits, you really want to stick within the network, and it will definitely control your health care costs. For members that are in PPO plans, using providers outside of the plan's network is allowed, but it will cost more out of pocket. For members that choose an HMO plan, services need to be accessed in the network. That means if you go outside of the network, those are not going to be covered services, and you're going to get stuck with the entire bill. All right. Now, starting October 15th, this is what we call the annual enrollment period. Some people call it open enrollment. What that means is between October 15th and December 7th, if you are on Medicare Parts A and Part B, you can enroll in any Medicare Advantage plan, no questions asked. That's what open enrollment is. So when you go, you're going to want to take your original Medicare card, a list of any medications you take, and of course, the name of your primary care physician. Your agent will go tippity-tappity on their computer, and they will input your prescriptions and your physician, and they will be able to search for plans which utilize your primary care physician and include as many of your prescriptions as possible. And this is how a good independent agent helps you save money. So those are the very bare minimum basics of Medicare 101. I encourage you strongly to go to rcmoneycoach.com/Medicare and grab those emails. There's no obligation. They're free. All that information is free and it will come to you right in your email and you can look at it and listen to it right there on your computer or on your smartphone. And until next time, you know what I'm going to say, be grateful and you will attract good things. This is Ronda Cobb, the Money Coach. Have an awesome day.